Hi, my name is Andrew Levy, and today I'm going to be doing an in-service on the TS7000DV robotic surgical table. The TS7000DV is a general surgical table with a weight capacity of 1,000 pounds in any articulation, including slide. It is also about 2 inches wider and has thick viscoelastic pads to accommodate bariatric patients. You'll notice that the base of the table is raised above the ground to allow feet to be positioned closer to the patient, and the cutout at the foot end to allow for better access during GYN and colorectal procedures. On the column, there are backup controls available if the hand control malfunctions. The column controls are locked, so you must press the green key button at the top right before using them. The DV table is a sliding table with a range of 18 inches. The table will slide 11 inches towards the feet and 7 inches towards the head. The table has a max height of 45 inches and a low height of 23 inches. It can also reach up to 45 degrees of Trendelenburg and reverse Trendelenburg, and also 30 degrees of tilt, with each articulation being 15 degrees beyond most tables. One of the main differences between the 7000 DV and our competition is the hook coupling component system. Rather than worrying about positioning rods straight and screwing the locks in, the 7000 DV uses a hook shape to secure the components to the table. Once coupled, the component automatically locks itself to the table. To remove, press the blue tabs underneath the foot end or the blue thumb buttons at the side of the head section. The head section has normal up and down movement along with a third degree of articulation designed to better help position patients during lateral and bariatric procedures, along with assisting anesthesia and intubation. To use, pull the blue paddle underneath the right hand side of the head section and place your left hand on the rail to guide it. At the top of the remote, you'll see the LCD touchscreen with bed position information, the DV button for use with the DaVinci robot, your lock, your unlock, and fifth wheel assist buttons. As you move down the hand control, you'll notice that it is laid out from anesthesia's point of view, beginning with the column and working down from the foot end to the head of the bed. In order to manipulate the table independently of the robot, you must first press the DV standalone button at the bottom of the remote. Once pressed, you will see a question appear on the touchscreen asking you if you are docked to a patient with the robot. Tap No on the screen and you will see the buttons illuminate, meaning the controls have been enabled. Now I will move on to integrated table motion with the DaVinci Xi robot. This table is designed to be used during robotic procedures not only because of the large articulation ranges, but because it has the added benefit of being able to reposition a patient during a robotic procedure without removing the arms from the body, all while the surgeon is still able to continue to perform the procedure while moving. In order to pair the robot and the table, you must first turn both on and let them recognize each other, indicated by the DV light illuminating. Note that the table and the robot are still not paired, only recognizing each other at this point, indicated by the DV with a red line through it at the top left of the touchscreen. Once the table and robot recognize each other, press the illuminated DV button at the top of the hand control. Next, go to the tower's touchscreen and you'll notice the table icon at the bottom right should now be selected. Above that, you should see a button that says Pair. Tap this icon and the table and robot should connect within a few seconds. All of the buttons on the hand control should illuminate, giving you full control of the table. Position the patient as usual and begin inserting the instruments. Once the first instrument is inserted, the hand control should go dark, disabling the controls until the case is over and instruments are removed. If during the procedure the surgeon decides that they want to reposition the table, first anesthesia must confirm that the surgeon, number 1, is actively controlling the hand controls, number 2, has their head in the viewfinder, and number 3, has all instruments in the field of view. If these criteria aren't met before or during ITM, the motion either will not start in the first place or it will discontinue motion if it has already started. Once confirmed the criteria for ITM has been met, anesthesia will proceed to press the DV button at the top of the hand control. The robot should respond with an audible confirmation of table motion activation once the button is pressed, and the anesthesia provider can begin to move the table in any articulation to reposition the patient. Once finished, press the DV button once more to deactivate it. Now I'll move on to the accessories. Included in our advanced package are split legs, adjustable and rotatable footboards, a pelvic extension, and a lightweight transfer board, and also the required number of rail clamps. The split legs go on the same as all the other components by mating the hook to the table. Keep the block on the split leg aligned with the empty space on the coupling mechanism on the table for easy attachment. To manipulate the split legs, simply release the latch underneath the split leg, move into position, and secure the latch. Included with the split legs are footboards for each leg. To attach, unscrew the blue starburst connector and unfold it 90 degrees. Locate which side it belongs to and slide it onto the rail. Make sure to tighten down the rail clamps and the starburst before positioning the patient. In the case of a tall patient, the pelvic extension can be used to increase the length of the tabletop. The pelvic extension also goes on the same as the other components. To attach, first remove the leg section. Place the pelvic extension in the place of the foot section and then attach the foot section to the pelvic extension. This should afford you an extra 6 inches of table and imaging space. If you find yourself in need of a footboard, at the base of the rack you should find the rotatable footboard. The rotatable footboard is dual purpose. It can be used as a tabletop extension and also as a footboard. To attach, first unscrew one of the black knobs on the bottom side to adjust the width to the table's width. Next, place rail clamps on the table and set the footboards into them and lock. When laid flat, this serves as a table extension. Now locate the black knobs on the side. If you pull these out and give them a small turn, they should lock in place and allow the footboard to rotate upwards 90 degrees. Give the knobs a small turn back to their original position, and they should snap back into place, securing the footboard. For lithotomy procedures, the lightweight transfer board will be used. In order to use the lightweight transfer board, first remove the head and foot section and place them securely on the rack. Next, remove the lightweight transfer board from the rack and install it like you would any of the other components. To reduce back strain, it is easy to secure the transfer board to the table by placing the blue knobs on the ground or on your knee. Place the ball of the board into the socket of the table and lift up into position. To remove, reverse this process. Although the table has a flat surface at the base, please pay extra attention to items that may have been left sitting on it. SCD machines and other objects left underneath the table can inadvertently damage the table when it is lowered or a section moved. As an extra precaution, we have a cladding protection ring surrounding the base to prevent damage. If the table is not responding and you are having trouble with it, first try turning the table off and powering it back up. If that doesn't work, you can find a general reset button at the bottom of the column and the side facing the head of the table. Remove the plastic bulb, rotate it 180 degrees, and use it to depress the reset button recessed in the column for 5 seconds. If the table is plugged in, it should automatically restart. If it's unplugged, simply power it back on using the on button on the column. This should resolve most issues. In case of an emergency, press the floor lock release button at the base of the table to unlock the table immediately. In the extremely rare occurrence that the table and the robot lose wireless connectivity, you can hardwire them using the gray cable most likely stored in the top drawer of your DaVinci tower. To connect, first locate the secondary remote port underneath the table on the foot side of the column and secure the cable to the table. Next, go to the back of the robot itself and locate the port for the other side of the cable. There is only one port it will fit into, and it is protected by a metal shield. Remove this shield by the 2 screws at each end and connect the cable to the robot. Check the table menu on the screen on the tower to confirm connectivity. That's all I have for this video, but if you have any questions, comments, or concerns, feel free to reach out to your clinical support specialist or sales associate, and we will do our best to address them. Thanks for choosing Hillrom and our TruSystem 7000 DV robotic surgical table.